Are you seeing more people come in to see you about it thinking that they have ADHD, and when you do your evaluation, it's not there?
I feel like a lot of people nowadays, like, in terms of how our society has cultivated this quick to move on type of communication and interest. We're constantly moving on to the next best thing, sifting through social media. So it's hard to distinguish: is that something that has been cultivated by society, or is it something innately that is in you?
When I think back to college, there is a black market, underground hill market that exists, especially for ADHD medication, because from what I've heard, it's performance enhancing.
Medicine,
Law, friendship. This is Dr. Long and Lawyer Nik. You're listening to the Medico-Legal Brief.
one doctor, one lawyer, and a whole lot of gray area.
Hello, viewers. Welcome back to another episode of the Medical Legal Brief here with Dr. Long and Lawyer Nik. If you haven't already, please make sure you subscribe, like, follow on whichever platform you choose. We're mostly on YouTube and Spotify, but also on Instagram and TikTok, so find us there. We've got a great topic for you today, as always, but this week we're going to talk about ADHD.
So, Long, I feel like the first time we experienced ADHD was in college, and we'll get to it, but it was somebody would have ADHD, somebody would have the drugs associated with ADHD, and then from there it was the college thing of, hey, how can I take your ADHD medication to successfully pass my classes?
Mhm.
But as time has gone on and we become more aware of it, seems like people, or at least kids, teenagers, adults, have been called out more for having ADHD, and it's become more of a common diagnosis. And so I'm looking forward to the conversation, and I'm interested in hearing the science and the medical background on ADHD and just learning more.
The first thing is, what does ADHD stand for? It's basically attentive disorder or hyperactive disorder, and it's a diagnosis of clinical judgment. So it's not something that you can do blood work for. It's not something that you get tested for. Well, you get a survey or a questionnaire, and sometimes they do further evaluations into your work history, your school history, your academics to help build that case to whether or not you have the diagnosis of ADHD. And you're right, ADHD has become more prevalent, and it's definitely being diagnosed more. There's several perspectives on why that is. One, we just have better tools, better understanding of what ADHD is, so we know how to test and when to test. And the other thing is that we used to miss a lot of ADHD, especially in little girls. Way back when, we would miss the inattentive cases where girls would just not pay attention, they wouldn't speak up, and they would still do semi-okay. As they got older, they then eventually got diagnosed as adults. And so we missed that whole generation of patients that probably truly had ADHD. The other perspective that some people have is that we are probably overdiagnosing. A lot of people are finding that they can't focus as well, and I don't necessarily think that that is a natural cause of their body, but potentially due to societal pressures. We deal with TikTok, we deal with Instagram, social media. Everything is very clickbait. Everything is very quick to capture the viewer, and if you don't capture the viewer within 5-10 seconds, then they're moving on to the next thing. So that's been cultivated in our society. That has cultivated this mentality of, oh, we got to keep moving on to the next topic, and that obviously can look like ADHD at times.
And that goes to something I was planning on doing a little bit later on when we're actually walking through ADHD. I always try to put my lawyer hat on, and I try to look at both sides of the argument. And we never want to insult anybody. We never want to lead somebody to believe that we don't believe that they have a certain mental condition or mental disorder. But I was going to ask about the underdiagnosis versus the overdiagnosis, because I feel there's this gray area that exists with any sort of mental or cognitive disorder, especially when we're looking at kiddos, where we're trying to figure out, are we overdiagnosing something that doesn't really exist and can be solved with other solutions? Or is it something that we truly need to pay more attention to? And so I'm interested to hear your take on some of those approaches. And like I said, we're not trying to insult. I'm not trying to insult, but there are a few pressing questions I have for you regarding over and under diagnosis?
Absolutely. And like I said, it presents itself very differently and
Mhm.
in different ranges among people. Some people may have mild ADHD. Some people may have very severe ADHD. Some people, it may be more of the hyperactive, like the kid bouncing off the walls versus a kid that's very quiet and is just losing focus or zoning out. There are different ranges, and a child can be on that spectrum of ADHD. And that's where the delineation really lies with your physician and sitting down with them, doing a proper workup, doing a proper evaluation, and potentially even getting you over to the specialist to talk to the psychologist, psychiatrist, or the neuropsychologist.
With that, you've walked through a 30,000-foot view on ADHD. So I want to open the door for you as a medical professional, as a physician. What is your experience with ADHD?
My personal experience, I don't think I really paid much attention to what ADHD was in our childhood growing up. I don't think it was that well known, and I don't think that many kids were diagnosed as we were growing up. I started noticing it a little bit more in high school and definitely noticed it more in college. A lot more people were on stimulants, whether they were prescribed it or not. I noticed that people were utilizing it to do all nighters to study better for a big test. And so that was being used more in college. And then once I actually got to medical school, now I'm seeing it in a majority of my colleagues who were truly diagnosed with ADHD, and they are utilizing it on a daily basis to just function. It's been this gradual progression through my growth in life. And I sometimes wonder if I personally have some ADHD on just a very mild spectrum. I'm actually personally going to get tested for it just to make sure that it's not something that I need to manage down the line, or maybe something that I could improve in my life. And so I never like to just chalk it up to something. I always want to evaluate what the root cause is and potentially come up with a remedy.
I like that point you just made as to you've never really been tested for it, but you think that you might be somewhere on that spectrum because I have felt the same way in parts of my life. And what has triggered that is I have family members that have ADHD. When you hear of somebody in your family having it and think of maybe something's being passed down genetically, you think, do I have it as well? However, I've also taken the approach of, okay, maybe I'm just having too much caffeine, or maybe I didn't work out enough, or maybe I'm just losing track of my attention because I'm bored with the subject matter. So there are certain things that in my mind I've triggered. Maybe I have it, but other times, like, no, I don't have it. It's almost the man up mentality, which back when we were kids, we probably saw a lot of with the other kids that were hyperactive, where that kid might just be a brat, or that kid wasn't disciplined, or that kid had other issues and just couldn't sit still and just couldn't pay attention because they weren't getting out to recess enough. There's maybe some justifications that we make as individuals and probably as parents too to justify why or why not you should go get tested for something of that sort.
The other misconception is that people think ADHD is something that can be a huge detriment to someone's education, but a lot of people actually make it through their educational career doing okay. They may not be the worst, they might be average, and they're able to do that without medication and without being truly diagnosed until a later date because they are able to figure out coping mechanisms, or they're able to figure out other techniques or skills to hide and mask their shortcomings. We do see that a lot in professionals, and I'm curious to see whether or not you saw that in your own journey, especially through law school, because in medical school and in residency, if my colleagues were struggling, they would then go get evaluated, and a good chunk of them would officially get the diagnosis of ADHD at a later age, at that adult stage, rather than that childhood. It's a lot harder to get that diagnosis, but a lot do. You're thinking these are the people who did really well in high school, did really well in college, and now they're finally struggling in medical school and residency, and that's when they get the ADHD diagnosis. It's a very wide range, and it's a misconception that you think that ADHD can deter. Of course, it can, but there are some people that slip through the cracks and are able to find ways around it without actually needing the medication.
Another point that I've thought of, and you again triggered this thought. Let's say that, for instance, you go in and you get tested, and your medical professional determines that you have ADHD. It's kind of odd to think about how much more successful you may have been throughout your education and your career if you had maybe addressed it earlier on. You're a smart individual. You are a very type A. You are scheduled. You are smart. You hold your stuff down. How much further could you have gone if you have had it, had you had been able to address it and take the steps to correct what needs to be corrected?
You mean you want to see more OCD
Yeah.
tendencies come to fruition? I'm actually curious. Do you feel like ADHD was something that your parents would have welcomed or taken seriously, or do you think that that was something they would have said, "Hey, it's probably something that we can work on at home"? Because I do see a lot of parents who opt to not go the medication route, and let's work on those techniques and those skills to get through it.
I can give you from firsthand experience. My brother has ADHD, and my parents went through childhood thinking that he was just a problem child. He was a very good kid, but when it came to education, when it came to him sitting still, he couldn't pay attention that much. He was trying to find his way through his education, and my parents were just like, it's not a medical issue. It's just he's a hyperactive kid. So let's do the things that we would need to do for a hyperactive kid, which is we're going to get him into sports. We're going to have him run around a bunch from a disciplinary aspect of we're going to put him in timeout. We're going to use the punishments of taking toys away just to try to get him under control. And my brother by no means was a bad kid. He was a really good kid. He's a great guy. But he had those struggles that when it came to high school, my brother spoke out and said, I think there's something wrong. There's something wrong here. And my parents said, no, you're fine. We've taken you to the pediatrician. You are absolutely fine. And that goes to the fact that, we're in our 30s. Back then, it just wasn't that big of a deal. And when he finally got into college, he convinced my mom to go along. He went to go see a doctor because at that point, he's an adult, young adult, but still an adult. And they diagnosed him with ADHD. So they were able to give him the medications and it helped him tremendously. It helped him focus. It helped him finish up college. He's a successful individual. It was just night and day, which then makes you think, where could he have been if he had addressed this problem earlier on in his life? But old school way of thinking was, no, we got to take care of the kid. We just more discipline, more timeouts, more running around, and we'll get him there.
My parents were exactly the same. If anything like that was brought up, then they felt like it was more of their issue, like it was something that they were not doing at home. They were not disciplining enough. They were not setting up rules and boundaries and barriers appropriately, and that's why I was a goody two shoes. So I never had that issue. But my little brother also similarly. We called him a rebel. He basically did everything the opposite of what my parents are always said. But he did struggle in school slightly, but he still did very well. He ended up becoming a mechanical engineer, did really well from there. But he also got diagnosed with ADHD later in life because my parents didn't take us to the doctors for really much at all, let alone going for ADHD testing. So a very similar history here in terms of childhood. But you said that it was not a big deal, and I got the wrong choice in words. I think it was more of it was not as big of a focus at that time and a lack of understanding as a community, as parents. It was just not something that was in the forefront of their mind and not something that they would consider like a true and real diagnosis at that time and age. They've grown to understand it differently now. And obviously parents now our age understand it a lot more and are more willing to make sure that our kids are diagnosed, treated appropriately so that they can succeed in their lives and their education.
My mom has actually brought it up to us in the past where she feels really guilty now after the dust has settled and he's been diagnosed. But she's also the same mom that when my brother went to her when he was in college and asked if he could buy $200 worth of Bitcoin at like $3 a coin, she said, you're absolutely crazy. And somebody on the internet's just going to steal your money. So she feels guilty for a lot of things. And those are two of the big ones when it comes to my brother. To bring it back medically, I think that I might have ADHD. I want to be evaluated. Am I going to my PCP, my primary? Am I going to a psychologist? Am I going to a psychiatrist? What are the different avenues to determine whether or not ADHD impacts me?
Again, it depends on age, but the younger that you are, the easier it is to test. Therefore, at a younger age, majority of primary care physicians, family doctors, pediatricians are very comfortable treating and diagnosing ADHD at a younger age because it is a lot easier to determine. It's basically a questionnaire that goes through day-to-day activities, how much focus, how much inattention they have, are they paying attention in school, in class, and the questionnaire has to be answered by two separate adults and in two separate settings. So one at home, one at school is usually the most common way to diagnose it. And again, your primary care physician or your pediatrician. Both are trained and are able to do those testing and evaluations. If they didn't feel comfortable for some reason, they can send you over to the psychiatrist or psychologist who will then sit down and do a very similar, but more likely a little bit more thorough exam because they do have the time to do so. Now, if we go up to more of the adult stage, so someone above the age of 18, no longer in school, now they're in work, it becomes a little bit harder to delineate what is true inattention versus drug seeking versus other distractions, other stressors that may be causing you to be inattentive. Most primary care physicians, you want to start there. Or you want to let them know that this is your concern and this is what you want to get tested for. And then they will determine who to send you to. So depending on the local area, your primary care physician may send you to either a neuropsychologist if they do the evaluation, a psychologist, or a psychiatrist. And so the difference between all three of those is just the specialization of what they have been educated on. Psychiatrists does a lot of the medications they're able to prescribe. They can also do the testing. Psychologist truly just does the diagnosis, the therapy component of it, but they do not prescribe. And then the neuropsychologist goes into the nitty gritty of potentially autism, anxiety, depression. They try to glean out all the different potential behavioral or psychological components of the issue.
Now, I'm going to use a reference to one of our other podcasts as a terminology podcast. We had talked about Alzheimer's being its own diagnosis, but being a part of the wider dementia. So is ADHD part of the wider autism spectrum? Are they related at all?
They are not related at all. ADHD is completely different from autism. They can go hand in hand in terms of a patient can have both, but no, one does not cause one. They're not correlated in any way. So a person that has ADHD doesn't mean that they have autism, and a person that has autism doesn't necessarily mean they will always have ADHD.
In this day and age, the autism spectrum that goes into a lot more underdiagnosed versus overdiagnosed when you're looking at where individuals fall on that spectrum. There might be some confusion with ADHD being mixed in with autism at times. And so I appreciate the clarification there.
To clarify it even more, autism is more of a social, interpersonal issue where they're not able to distinguish between emotions. They're not able to socially communicate well like other people their age, whereas ADHD is more of an inattention, ability to focus, ability to complete tasks. So a completely different part of the brain that you're focusing on.
Now, another question for you is, once you're diagnosed with ADHD, can you be quote unquote healed? Can it ever go away? Is it like diabetes where it's just stuck with you for the rest of your life? What does that situation look like?
Yeah. Once you have the diagnosis, you have it forever. You don't have to utilize medications, but you can. It's obviously the first recommendation is that you get started on a stimulant right away to help treat. But you can go through life, you can go through therapy, counseling, and figure out coping mechanisms. You can figure out tips and tricks around your work system, your life, to figure out how you can stay focused and stay on task and come off of medication. So there is that opportunity. But I will say that the majority of patients who truly need the medication, it makes such a big difference that they do end up staying on it indefinitely.
And that's a good segue. Let's talk about the medication. When you're talking about ADHD, the medication aspect goes hand in hand, and that what leads to some of the issues down the line, either from a societal standpoint, a medical standpoint, or even a legal standpoint.
Medication standpoint, again, first line for ADHD is going to be a stimulant. So stimulants are considered controlled substances. So these are the things that we're talking about when we say Adderall, Concerta, Ritalin, or Vyvanse. These are all stimulants. They are meant to be taken once or twice a day, depending on the type of formulation you get. They basically are uppers. They heighten your focus. They heighten everything so that you're able to finish and complete tasks. Now, second line medications, they do have non-stimulants. So things like Strattera, there's a new fluoxetine out there, clonidine. So there are other options that are non-stimulants. They work too for some patients. I would say that they're more likely to not work as well as stimulants comparatively if you're comparing one to one. But that is an option. And we usually go to non-stimulants if parents don't want to put their kids on a stimulant. That's one reason. Another reason is maybe the patient can't tolerate a stimulant. Maybe it's causing issues. Maybe it's causing high blood pressure, high heart rate. It's making them more anxious. There's a lot of reasons why a stimulant may not be good, and therefore they're going on the non-stimulant. And then the third option is maybe they have a history of substance abuse. They have a very addictive personality. They have alcohol use, tobacco use, and maybe this is something that the physician doesn't feel comfortable putting them on another controlled substance. Therefore, we try to mitigate that by doing something like a non-stimulant.
Very dumb question on my part, but
No dumb questions. No such thing.
There you go. If you have an individual who is having trouble trying to focus, might be all over the place, can't sit back and be attentive, why a stimulant? Wouldn't that encourage that action even more so? If they're already bouncing around and they can't focus, what is about the stimulant that prevents them from doing that even more?
Without getting into the
Uh,
pharmacology of the actual medication, we call it a stimulant because what it does is it kind of the focus. It's not necessarily causing you to like bounce around more. It's not the correct way to think about what the terminology we're using for. It's meant to hyper focus. It's meant to help you focus better, and so it stimulates that part of your brain
Okay.
to keep it as easy as possible to understand.
And it's my understanding as far as these medications, these prescriptions, from legally they're a Schedule 2 drug, so on the same level as like a cocaine. But if you were to take it and take a drug test, would it not show up as a methamphetamine? Could it show that you have illicit drugs in your system depending on the situation?
Correct. Depending on the drug screen, there are different versions of drug screens, a very generic one versus a very specific one. So if it's a generic one, yes, it's going to show up as methamphetamine. And if maybe the person doesn't know that you're on ADHD medications, they may assume that you've been taking some meth or some cocaine or something in the same ballpark. But if they know that you have ADHD, then they're more likely going to assume that, hey, that's why it's positive, is because you're on medication. This is why it's very important that you follow up with your physician, that you continue to do close follow-ups. We usually have patients come back every 6 months to make sure that we are checking in on dosing, making sure everything's working appropriately, and again, making sure we abide by the legal rules that are laid out there for us.
Now, are you seeing more people come in to see you about it thinking that they have ADHD, and when you do your review, your evaluation, it's not there?
Always, we talked about this earlier here on the episode in terms of how our society has cultivated this quick to move on type of communication and interest. Right? So we're constantly moving on to the next best thing. Sifting through social media, it's just so quick. So it's hard to distinguish: is that something that has been cultivated by society, or is it something innately that is in you? So yes, I do have a lot of patients that come in, and that's why we do a very thorough evaluation. I will always start out with some blood work, making sure that there's nothing wrong physically with you. Next thing, depending on age, I might send you over to the psychologist because then they have a little bit more time to actually dig through your history. They're going to go through your childhood. They're going to go through your academics, your work life, your personal life, and see, is there any other reason why you may not be able to focus? Is it because you are just under a lot of stress? Maybe you've got 6 kids. Maybe you're not sleeping overnight. Like Nick, I wouldn't be surprised if you're not focusing well because you just have a newborn. So there's a lot of other reasons that could be causing similar symptoms to ADHD. Some people who have sleep apnea, who are just getting 2, 3 hours of sleep a night, they're not going to focus that well. And sometimes they come in to see me. And instead of me diagnosing them with ADHD, I diagnose them with sleep apnea. We get them treated and then they feel much better.
We've talked about this before. You're a big proponent in being very proactive with your health. Go get your cancer screenings, do your physicals, make sure you're keeping up on being as healthy of an individual as possible. Is there any relation to ADHD and mortality rate, life expectancy? If you're diagnosed with ADHD, is it going to impact your health to such an extent that you're looking at an early death?
There is no study that can accurately give us that information yet. But if we think of correlation, there might be. Obviously, someone who is not able to be as productive, able to keep down their job, maybe they're not hanging on to their relationships as well as they should be, then yes, of course, they may have a harder time in life, therefore a shorter time in life.
Mhm.
But
That
again,
makes sense.
no direct data out there that we can say, oh yes, uncontrolled ADHD will lead to this. But we can always connect those dots by just looking at the overall short-term effects, which then can lead to long-term effects.
Now it's more of a casual conversation for us. Now that you're a doctor and you understand these things and you understand the prescription aspect of it, and for me as a lawyer, understanding the legal aspect of it, when I think back to college, there is a black market underground pill market that exists, especially for ADHD medication, because from what I've heard, it's performance enhancing. If you do not have ADHD, by taking one of these pills, it can really help you, apparently. Is it something in which, looking back now, you're like, I understand why these college students or these high school students or these med students were taking this? Or do you look at it like, oh my gosh, that was such a risk? Because legally, looking back, it was such a risk. But medically, do you look back and say, I have a better understanding of what was going on?
Big risk. Again, it's a controlled substance for a reason. There's a lot of side effects and a lot of things that your physician wants to monitor when you're on it. So if you're someone that was not prescribed it, maybe you have a heart condition that you don't know about and you're going to take this medication and it causes an issue. Maybe you're buying a pill that they said is an ADHD medication, but it turns out not to be. There are stories like that where they think that they're taking a stimulant, but it turns out to be like fentanyl or something completely different. Looking back now, absolutely not safe to do. Would not recommend it at all. If you think you have a attention deficit disorder or concern or issue, go see your family doctor, go see your pediatrician, go see your primary care physician so that they can properly diagnose you and properly treat you. But you tell me, what are those legal ramifications if, say, you or I had indulged back in our college days?
It's similar to any drug. When we think of drugs, we think of the hard street drugs. We think of marijuana and cocaine and meth and now fentanyl and the gambit of different street drugs that exist out there. But we've talked about in our other podcasts, a lot of these street drugs grew from prescription drug testing, and then they became street drugs by abuse. So looking at the ADHD medication, although it's a prescription, it's still a drug. It's still a Schedule II drug. You may have been prescribed this by your medical professional, but as soon as you hand it to somebody else, as soon as you decide to sell that little pill, as soon as you decide to drug deal, essentially, you were opening yourself up to a world of legal risk and a world of criminal liability. You now have situations in which you can be popped for distribution, possession with intent to distribute, and those can be state charges, they can be federal charges, and then you can get these other aspects of both wrongful death. Let's say that you had a pill and you gave a pill to a friend, and to your point, they had a heart condition, and all of a sudden they end up in the emergency room and drop dead from it. Then you can be liable for giving that pill civilly and criminally. There's also instances, and I thought this was really interesting because we do a little bit of research before the podcast, and I thought this was super interesting. Insurance fraud. As you go in and you're being prescribed these pills, if you're lying about how much you're taking, if you're not taking it, if you're getting refills too drastically, it could come as a point of insurance fraud because you are fraudulently claiming to insurance that you need more pills than you actually need, and then you're turning around and selling it on your underground black market. I would really press into the viewers that there is obviously legally a little bit of a difference between selling something and giving it, but you're still distributing. If you're just handing your prescription pill to your friend, you can get in a lot of trouble. And to some extent, the ADHD medication could be even more criminally intrusive in your life than like if you were to sell weed. A lot of people, especially college kids, high school kids, they don't think about that. They think, oh, this is a prescription drug. It was given to me by a doctor. It's safe. So if I hand it to somebody else, there's no issue with that.
Do you see, is there a different sort of consequence depending on age? Like, say it was a 16-year-old who was caught versus a 24-year-old that was caught. Are we talking about jail time? Are we talking about community service? Like, what have you seen? I'm assuming it depends. I'm assuming it's a wide range.
You hit on the head with it depends. And we talked about this in our last podcast about the penal code. Whatever your penal code says, your criminal code says, yeah, there are some instances like 18 is generally the age of being an adult. So if you're under 18, you're most likely not going to see the same repercussions as you would as an adult. You might be looking at juvenile detention. You might be looking at community service, just local disciplinary action. As soon as you're over the age of 18, this is for any crime, you're opening yourself up to state and federal charges. Now, based on your jurisdiction, based on your record, based on your experiences, if not only are you selling your ADHD medication, but you're selling cocaine and meth and you're a full-blown drug dealer, the charges might be a little steeper. But if you're a college kid and you gave your roommate one pill, it might be a little bit different. So it just depends on how into the distribution you are, whether you're selling it, whether you're not selling it, just circumstantial and situational. But it doesn't only impact from a criminal or civil standpoint, it can also impact your education. A lot of colleges and universities and higher education, they have student code of conducts. So you can also find a way to where you get busted maybe from a campus cop or maybe from your dorm room RA, and now you're getting kicked out of school or you're getting your scholarship revoked or you're facing some sort of consequences that aren't essentially legal. And again, I don't think a lot of people think about that.
And another thing to add is another repercussion you can see is actually in the medical field. So once you have been deemed as someone that is untrustworthy by your physician, it actually goes onto your chart. So if we find out that you have been distributing your prescription unlawfully, or you are taking other medications on top of it that we did not agree to, then you have essentially broken your controlled substance contract. We will then place that diagnosis into your chart saying that you have broken your contract, and that actually follows you throughout the rest of your life. It will then become much harder down the line for you to get any sort of controlled substance. Doesn't mean you won't get treated for high blood pressure, diabetes, but when it comes to things that will require controlled substances like pain medication, oxycodone, hydrocodone, you might not get it as easily. People may be a little bit more hesitant. They may take a step back and take a little bit longer to decide, is it worth it? Is it appropriate? They're going to second guess the situation a little bit more. And things like benzos or anxiety medications, if you're having a panic attack, some people may take pause at that and like, is this truly a panic attack or are they drug seeking? It does cause you to then have this reputation, even though unknowingly, it's not a reputation that is verbally spoken out, but it's in your chart, and someone that views your chart will immediately understand why this was in there, and then make judgments, based on that, even if they've never met you. And so that's something that you would be risking, and also another repercussion by distributing these things without, um, when you're doing it inappropriately.
That reminds me of when you have to go get, what is it, Sudafed at the pharmacy, and you gotta turn over your driver's license to make sure you don't have a meth house in the backyard. You don't think about the restrictions that exist past your everyday life for the people that actually break the rules and break the law.
hmm So we've been talking about all the negative sides of ADHD and what can happen if we distributed or sold these medications when we're not supposed to. What are the legal ramifications of the accommodations that are given to ADHD patients? So students, workers, they actually get special treatment sometimes, extra time allotted for testing, working, etc. What do you see from a legal standpoint in terms of those protections?
We look at the American with Disabilities Act, the ADA. If you've ever worked corporate or if you've been in school at a higher education level, you've probably seen this paperwork that exists. It's probably in your HR packet. And if you don't have a disability, most of the time you're just flipping past it because it doesn't apply to you. But for those individuals with disabilities, the ADA prevents against discrimination from employment, state and local government services. It also has some public accommodations within your workplace. It's set to make sure that you're not discriminating against those with a disability. Now, from my understanding about the ADA, it's defined as you need two things. You need a physical or mental impairment. That's the first thing. And the second thing is that it limits one or more major life activities. You have to be able to identify your disability under those two prongs because they're very important for a company or a job to provide those specific accommodations. To put it very, very simply, if you have a disability that doesn't really apply to your job, you can't just ask for accommodations just because. You need to be able to have that relation that exists on top of the disability.
Got it. You never answered my question earlier about law school. Did you see a lot of law students on ADHD? Were they diagnosed with ADHD? What was your experience going through law school?
During law school, it was a lot of don't ask, don't tell, where if you knew about it, you knew about it. If you didn't, you didn't. And I was not in a group that relied on any sort of medication or illicit drug activity. I would say, if anything, my group probably drank more than taking drugs. And that was actually a joke that we had in law school, especially when it comes to ethics. And everybody take this as a joke, but lawyers are more akin to the drinking and doctors are more akin to the pills and medications. And that was just the joke that we had, at least at our school. But I don't see that it was very prevalent. But the thing about law school is you are going through a 3-year process, you're paying a lot of money, and there is a lot that is on the line. To be vocal about it and to be outspoken about it, you're risking a lot, at least in the state of Texas, when you're applying for bar membership, because you have to apply to the bar and not only take the bar exam, but apply. There are questions about illicit drug activity, about weed and marijuana and steroids and everything else, and have you partake? And that could end up going to a character evaluation. Are you fit to be a lawyer in this jurisdiction? So I would say everybody is very, very quiet about it if they're taking it. At the same time, you could tell. You could tell who is able to maybe take the pill and get away with unprescribed ADHD medication. But at the same time, I don't think a lot of people are very vocal about the disability because if they had it, there's this stereotype from some people that are, I really want to apply for ADA accommodations, make sure that I have the best shot at succeeding. If I need accommodation, I'm gonna use that accommodation. There's another stereotype, a stigma of, well, I'm not going to talk about my disability. I'm not going to use it to gain anything. I'm not going to use it to benefit. I'm just going to shut my mouth about it. Even though I have it, I'm just going to be quiet, put my head down and work because they don't want the negative stigma that comes with it. From a law school perspective, those were two, it's just not talked about. I was the same way going into the legal profession as an attorney. Again, big boy, big girl job. You're an adult. There are a lot of repercussions. You don't want to lose your bar license. You don't want to be in front of the judge and have the judge accuse you of doing something. Like it can really impact a lot of things. And so I would feel like it was probably pretty hush hush.
Mhm. I want to bring it back and just speak as a practice physician that ADHD does get a bad rap. I mean, it does have a quite a negative connotation, especially in professionals. Like we have this idea that it's going to somehow deter us from achieving our career goals. People are going to look down on us. But I want to make sure that our viewers understand that ADHD truly is a real diagnosis that is necessarily when it's made. It's needed to be known so that we can appropriately treat it. I like to tell patients that if you truly have ADHD, it's like a patient may you're basically missing a limb, and for us to fix that by giving you medication to then have that limb back, like that's what we're trying to do is we're trying to make your body whole again. So I don't want anyone out there who thinks they may have ADHD be deterred from getting evaluated and treated appropriately. Because again, there are people out there who are abusing it, yes, but there are a lot more people who truly need the diagnosis made, evaluated, treated, and then they can better their lives and get through their education and their careers much, much more easily. You don't have to suffer through all of this.
That's full circle to our discussion a second ago about the ADA. It's when you are searching for an accommodation or your company or your school can find certain accommodations for what you need. So maybe you need to be in a quieter workplace. So they might be able to accommodate you by giving you an office that's away from everybody or a cubicle that's away from everybody or different work hours where maybe you can work from home. Other accommodations, you have seating accommodations, you have quiet accommodations, you have scheduling or deadline accommodations that could exist. So if it's something that you feel like might be impacting you to that level, to your point, you're doing things without a quote unquote limb. So if you can go to your place of business and say, hey, I need help on this end, this is what's going on, and talk it out with your employer or with your educator, there might exist a path forward to where you can be even more successful than you already are living with it because of the ability to maybe just have a more or a less strict deadline or a quieter workplace.
Exactly. The idea behind the treatment and the team behind you is to help you be the best person, be the best at your career, at your job, at your education as possible. There's no reason that you have to grin and bear through it all.
Now, with the same law school perspective, how was it in med school? Did you have a very similar to what I was explaining about law school? Did you have a very similar experience to med school? Because like, there's more of an understanding as to what's going on from that perspective than just lawyers doing legal stuff. You guys are med students with science backgrounds.
This is more of a generational change.
Mhm.
It was not spoken of as much. However, there were people diagnosed with ADHD, but it was not spoken of. It was no one like announced it, not because of being afraid, but it was just not something that we discussed. Nowadays, I do feel like people are looking for those accommodations more. If they're struggling, they're going to more quickly go to the doctors, especially if they're in professional school, whether that's law school, engineering school, medical school. Like they are going to come to the doctors and get evaluated more quickly so that they can remedy whatever issue they're having and get through their education more quickly. So I do think that that tide has turned in the professional world, but do still see patients struggling if they're in a blue collar job where they're more manual labor. They're doing something that is not a white collar job, then they tend to be overlooked. And so these are really the patients that I want to make sure that they are heard and they feel heard, that they can come and feel safe to get evaluated and treated by their physician.
And to take it more philosophical, and I really enjoy our philosophical back and forths. We have really good ones. when you're looking at people that are trying to get diagnosed and you're looking at, misdiagnoses or even overdiagnosis, it's hard because from a standpoint of an employer or an educator or a boss or what have you, you then look at the field and you're like, okay, everybody's got ADHD. How many more of these accommodations do I got to do? Everybody seems to have it, and this person looks completely normal, and that person I know is not taking their pills, and this person is taking the pills of the neighbor. Like, there's so many, almost like Boy Who Cried Wolf, that it might have a negative impact on the individuals that actually have it. And so I struggle with, to your point, the whole societal aspect, the TikTok, the Instagram, where you watch a 10-second video, you're self-diagnosing, and before you know it, everybody's got something. Everybody has the problem, and now we're all trying to find a way to get the drug or get the, I don't want to mislabel it, but there's also some attention that comes with that,
Mhm.
especially for the influencers online, where it's like, this is how I live with ADHD. They may not even have ADHD, and they're trying to just get the clicks. So what's your opinion on that? Do you think it's going the wrong way? You think it's going the right way? You think, I mean, where are you at with all that?
Again, I do think it is overdiagnosed. I do think there are
Mhm.
a lot of loose prescription pads out there that some doctors may not go through the proper channels and the full evaluation to determine whether or not they truly have ADHD. But again, that's a whole nother conversation. So I do think that there's a lot of that going around. But personally, I always make sure that we try to evaluate as thoroughly as possible. Make sure there's not some underlying anxiety, depression, bipolar. Is there some other psychological issue that may be sprouting its head right now and presenting similarly to ADHD? So
Mhm.
there's a lot of time that goes. Like I rarely have a patient that will come see me once or twice and then immediately get the diagnosis ADHD and get thrown on medication. We go through the proper testing evaluation, and it takes 6 months to a year to truly get that diagnosis sometimes because I really got to know the patient well before we can make that determination.
And I've never asked you this question, but and you're a professional, ethical healthcare provider. So you have to take everybody by their own, like you take what you get. So if an individual comes in, you can't make assumptions on that individual based on the five people that walked in your office before that. So you can't really make the call that says, I've seen this a million times. This is the seventh guy today. He just wants ADHD medication. He wants Adderall. I need to just like, I'm going to fly through this really fast. You actually have to take the time every single time to make sure you're doing a competent evaluation that you can stand behind every single time.
That's one thing I pride myself in is the ability to make sure I remove my biases. Because you're right, being in primary care, you see a lot of the same things over and over, but you also see a lot of the negative side of people, people who act out inappropriately, people who are not on their best behavior. And so, yes, you can become jaded. There are doctors out there who are jaded. The majority of us come into it with good intentions. We come in with a positive outlook and we want to believe and trust our patients. And so, the majority of us will go into that room assuming the best, and until that trust has been broken, we will believe everything that you tell us. We're going to gather as much information as we can. We may second guess or second double check and triple check our work by asking for more data points. But we're always going to trust the patient at the end of the day. We're not going to go, behind their back and do some other secret discussion with someone else or try to do a gotcha moment at all.
It's similar to our capitalism podcast, which if you haven't watched the capitalism podcast, it's a good one. But like with lawyers, we are most of the time in private practice, so you are selecting your clients just as much as your clients are selecting you. So there can exist those biases, and I'm not saying discrimination. I'm saying like a straight bias is where if you are a family law attorney, you might have a bias that you just don't trust dads. You trust moms, you just don't trust dads because your experience with dads as father figures, as husbands, etc. You could say, I don't want to represent dads. Like that's just what I want to do. I'm going to represent moms, or I'm going to represent certain sides of the case. And you guys don't get necessarily, unless you're in private practice, you guys don't get that when you're working with a giant healthcare provider.
That conversation really went nicely, smoothly, and went through all the different layers that I wanted to address. Anything you wanted to add at all, Lawyer Nick?
It was a great conversation. These topics, not a lot of people put like the legal and the medical together, which is part of our podcast. So I
Mhm.
appreciate the understanding because I always learn from you. I always learn more than I feel like I'm putting out. But it definitely brings up some legal arguments that exist that some people don't consider. It's just I have ADHD. I have a prescription med. Well, if you're a parent and you give that prescription med to your kid, like there's a problem there and there could be
Mhm.
dire circumstances and repercussions. So I like that we're able to intertwine it. And I like the understanding. There's a lot of information out there that's misunderstood, and I like to clear up on topics like this. So
Yeah.
I always appreciate your insight, Dr. Long.
I get as much out of this as I'm sure you get out of me. Because again, just being able to see the way you analyze and process some of the questions I give you and the topics we have is really interesting because that's not the way my mind works. My mind is a doctor mind, not a lawyer mind. So, but yeah, it's always a fun time talking to you. This will be the end of our episode here on the Medical Legal Brief with Dr. Long and Lawyer Nik. As always, make sure you subscribe, follow. We're on TikTok, we're on Instagram, but more importantly, we're on YouTube and Spotify. Listen to us. We did recently have some technical difficulties, but we are up and running again. Our new date of posting will be on Wednesday. So look out for those new weekly updates, new weekly episodes on Wednesday mornings at 10 Central Time.
Yes, we're doctors. Yes, we're lawyers. No, this podcast is not medical or legal advice. Do not take anything we say as a reason to perform your own heart surgery, represent yourself in court, or diagnose your neighbor's rash. This is for entertainment only. Think of it like hanging out with your smartest, wittiest friends, not a substitute for an actual appointment. If you act on anything we say without talking to your own professional, that's on you. Seriously, don't do that.